So from a neuropsych standpoint, if I'm going to do a full neuropsych battery, my professional opinion is that the norms out there for neuropsychs for kids, I don't feel comfortable doing a neuropsych on a child until they are 8 years old, because I just am not confident in the norms for kids younger than that. There are norms out there. There are people who do that, and that works for them. They have the education and the training, but where my training is, I feel like from 8 on up, I'll do a neuropsych. So with a typical neuropsych for a child, it would be probably a full IQ. So look at verbal abilities, nonverbal abilities, working memory, attention, concentration, processing speed, those types of things. Visual motor skills, so taking in information, producing a response on paper, visually. Memory, so looking at verbal memory, visual memory, again, attention and concentration is a part of that. Recall, recognition, all of those things. Attention and concentration, there's another test that looks solely at that. Trying to think. Executive functioning, so planning, sequencing, organizing, problem solving, all of those types of things, and also including social and emotional aspects as well. And if need be, if we need to do an academic too to throw that in to look at learning disabilities, we'll do that. You can't diagnose a learning disability off of just a brief IQ and a brief academic. You have to have a full IQ test and a full academic. So usually what I do, if I have a child who there's concerns for attention and concentration problems, I'll typically do a screener for IQ and a screener for academic to see, and then also look at attention issues. And then if the child is ADHD, we'll treat that first. Then bring the child back if we need to do further testing at that time to see what else is going on with them. Then we have a full IQ, full academic to look at learning disabilities or to look at any other type of cognitive problems that might be occurring. The reason is, and of course you look at social and emotional functioning as well within that, but the reason is if you test a child who has attention issues and give them a full IQ and a full academic test, you think they're going to pay attention? You think you're going to get valid results? It ain't going to happen. So, what you do is you screen to see what you've got, and then if you've got the attention issues, you treat that, then bring them back, and then go from there. That's just a more conservative approach, and it's the approach that I choose to take with patients. I feel like I get better results.